once again, thank you for being here. Very interesting subject today. We've been reading in the newspaper and seeing on television about some incredibly low-cost medical services in our area. And then we're finding out that those low-cost medical services are not really what they seem to be. Drew Bradley is our guest, and she is from the Latino Research Center at the University of Nevada and also affiliated with the Nevada State Health Department. Drew, first of all, welcome. Tell us a little bit, if you will, about this program that the university has just started, how it will impact students, particularly the Hispanic population students in our area.
It's more of a community project. The university has taken it on because we have established a very good relationship between the community, the Latino community, and the university, but the project and the campaign is really aimed towards the Latino community in Nevada at large, because that's where we're really seeing this problem. It's not really within students. It's more people from the ages of, I would say, about 25 to 55.
How did it happen to come to your attention that there was a problem in our community of this magnitude?
Well, for the past several years, there have been various news articles, both in southern Nevada and here in northern Nevada, of unlicensed physicians really sort of botching the procedures that they're doing and having their patients end up in the emergency room. So we've heard more and more reports in the last few years, and the health division decided that it was time to really start creating awareness and sort of try and prevent this from happening in the future. So they came to us to create this campaign and reach out to this community and make them aware of the problems and how to avoid it and how to detect a licensed provider.
Why is it more prevalent within the Hispanic community and not just the general community, or is it?
It's in Nevada. We're seeing it's mostly within the Latino community. Nationwide, you could argue that it's affecting different groups, but specifically here, there's a bunch of different reasons. You know, there's the language barrier. People want to go see a physician who speaks their language, is familiar with their culture, and in Nevada, we don't have very many physicians who can speak Spanish. There's a lot of office assistants who are able to speak Spanish. However, when you're in a professional medical setting, you really want to be able to speak in your first language to your physician about your health. Also, cultural norms in many Latin American countries, it's very common to go see the local doctor or the local pharmacist. If you're sick, you go to the pharmacy, you tell them, you know, how you're feeling, and they give you medicine, which here would require a prescription. So there's a lot of different things that come into play.
Does the Hispanic population in this area, do they kind of go to these types of people who, you know, don't charge a lot or simply don't have any medical credentials at all because they feel threatened to some degree because maybe they're here illegally and don't want to go to a regular physician?
I think that that's definitely part of it. There are some undocumented individuals going to these unlicensed physicians, but it's certainly not limited. It's really the entire Hispanic community, and you know, low cost is something that we don't really like to associate with these unlicensed physicians, just because we've seen a couple cases where especially in cosmetic surgery, these people are charging the same amount as a licensed surgeon would. So although low cost may be part of it, especially when it comes to dentistry, it's really a lot of different things, not just that there's a fear of deportation, but like I said before, it's just a cultural norm to see these healers. They call them healers, or they go to their local herb store and they're just used to speaking with people about their health and getting medication and medical advice.
Drew, this may be a bad analogy, but I kind of think of a witch doctor syndrome. I mean, I really do. Is that, are we headed in that direction?
I think definitely a part of it is that, just because, like I said, in many of these different countries, that would be the standard. It's more of an alternative form of medicine that people seek in Latin American countries as opposed to our Western form of medicine here in the United States. So that definitely plays a role. But again, there is, even if people are here legally and are legal permanent residents, there's still a fear of government, and there's this idea that if you go see a licensed physician, they're going to ask about your health insurance and your residency status and how are you going to be able to pay for these things. And we really want to show people through this campaign that that's not necessarily the case. And certainly there needs to be no fear of deportation when it comes to medical experts. I've spoken to many, and that's not even something that they ask about.
Drew, I've been bombarded with emails, a lot of them from you, about this particular campaign, and it seems now that you are on a mission of a tremendous public relations campaign to let the general public know what's happening, how it's impacting students at the university and others, and particularly the Hispanic population. What are some of your plans?
Well, we've started with our awareness campaign. There's two parts, I should say. There's two components to this public awareness project. And the part that I'm working on is the public awareness campaign, where we've made our awareness brochures that are both in English and Spanish. We have posters. We have a whole website available where people can go on and check how to, in detail more so than the brochures, how to find a licensed provider. But then the second component is a task force, which is being headed up by former Attorney General Frankie Sue Del Papa. And the task force is really, their main goal is to create an action plan, because right now there's no really clear path for how these cases are reported, who deals with the reports, and it's not the most efficient project, right, or the efficient way right now. So that's what Frankie Sue's trying to do, and I believe her final report will be coming out June 30th, and that's where she'll be making her recommendations when it comes to law enforcement and government.
Will this be an ongoing campaign? In other words, not something that we're going to hear a lot about now and then 4 months later say, hey, whatever happened to that great campaign they were talking about?
I think it definitely will be an ongoing campaign. I'm working on it through June, and we're going to have radio interviews radio PSAs running beginning next week, and they will run through May, June, and July. So it will be an ongoing process. We're looking for prevention, but unfortunately, I don't think that that's going to happen immediately. So I believe that we're going to be seeing more of these cases, but hopefully less than we are right now.
Mm-hmm. How can the general public become involved? Who do they need to call? What's your website? And what part can we play in the program?
Absolutely. The general public can really help by just passing the word along, referring people to our website, which is www.unr.edu/Latino Center. And these brochures are going to be available at many different local grocery stores, pharmacies. So just talk to their friends and family members about it, especially within the Latino community, so that there is awareness. And the brochures are a really great thing, because part of the problem is people don't know how to detect licensed providers, or they don't feel comfortable asking their physician whether or not they're licensed. But we outline the ways that you can tell, and you can go on the Board of Medical Examiners website and search by first name, last name, city. It's very helpful. So we're really relying on word of mouth and people just sharing this information with one another.
Have you documented some cases where people have actually been more injured than they were by going to one of these unlicensed kind of persons?
Oh, absolutely. We haven't documented them. They've been documented by the health division, and we've kind of researched what goes on behind the scenes. But certainly there was someone sent to the emergency room not too long ago, I believe last month, seeing an unlicensed dental assistant, an unlicensed dentist, and he had left something in her throat, and it clogged up her breathing, and she was sent to the emergency room. So, and then there was the woman, in Las Vegas who died from the plastic surgery procedure.
Drew, a very interesting program, and I think you're to be congratulated, University of Nevada, and certainly the state, for becoming involved in what has become a tremendous problem in not only this area, but throughout the entire state of Nevada. Thank you for being our guest.
Thank you for having me.
I'm Bob Carroll, and we will see you again next time.